Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Megha Shankar. She's an internal medicine physician in California, and she co-wrote the Kevin MD article, Strategies to Foster Meaningful Connection During Telemedicine Visits. Welcome to the show.
Thank you so much.
All right, we'll get into your article in a little bit, but first off, tell me your story and your journey to where you are today.
Sure, yeah. So I grew up in Chicago, and I actually spent a good amount of my childhood in Tokyo. My dad's job brought us over there, and so we spent the first 7 years of my childhood there, and then came back to Chicago, and I completed my undergrad and med school there, and then my residency at UW in Seattle, and then came down here to the Bay where I am now. And I think, throughout all of that, going from Chicago to Japan and kind of throughout the West Coast here, it's been a great way to learn about people and how different people act and how I can connect with them.
Fantastic. So, how has the pandemic affected you and your practice?
Yeah, so I think a lot of us have switched over to telehealth, and that's been a really, really big change in our practice. Not only in terms of how we practice, like logistics of, not being able to ask the nurse to help out with the BP or other things that may happen in clinic. It also changes the way we interact with patients and the way that we really make that rapport with them strong. And so that's been a really, really big change. And I've seen that in both the inpatient floors as well, where we oftentimes do the H&P over the phone so that we reduce exposure as much as we can. So I think it's happening everywhere, which is definitely not a thing that I could have thought of, 5 years ago.
Sure. Now, you co-authored the Kevin MD article, Strategies to Foster Meaningful Connection During Telemedicine Visits. And let me start by reading a short excerpt from that article. And your group writes, the communication challenges of telemedicine, further compounded by COVID-19 related stress, call for strategies to help clinicians forge meaningful interactions with patients during virtual visits. The Presence 5, published earlier this year in JAMA, comprises evidence-based guidelines to foster humanism and connection in clinical care. Now, before you get into talking about that and the Presence 5, tell me the problem that you're trying to solve that this framework addresses.
Yeah, definitely. So I think oftentimes when we have a screen in front of us and we have another person on the other side, there feels like there's a barrier to the kind of connection that we can make there. And so I think oftentimes in clinic, we use that presence, that physical being in the same place to kind of help us build that rapport. Without that there, it feels like the whole patient-physician rapport is jeopardized. And so we wanted to ask, is there a way to maintain that as we, do a lot of telehealth now?
All right, now, what is the Presence 5?
Yeah, so the Presence 5 is practices for fostering humanism in healthcare. And this really all started because of just the increase in demands of healthcare, trying to see more patients in a shorter amount of time, all the documentation that goes with that. And so these were created through formative work that involved patient-physician observations, interviews with patients, interviews with physicians, a systematic review. And then after all of that, using a Delphi panel to create the 5 that we came up with. And I think a lot of times it feels like, these should be things that we just do on our own. But I think a lot of times we need that really intentionality in what we do, and that can help wellness.
All right, so I'm a primary care internal medicine physician. So let's go into a little bit more detail in terms of exactly what those 5 entities are as part of your framework.
Definitely. So the first is to prepare with intention. And I think in person, a lot of times that means, at the door, pausing, taking a deep breath, and kind of resetting yourself before you walk in. For telehealth, that may mean some of the same things. You're not going to be pausing at the door, but you might pause before you turn on the screen. You still might take a deep breath. And I think here there's a lot of back-to-back appointments. So standing up can be really helpful just to break up the day. So that's a big one to start off with. The second one is listen intently and completely. And a big part of this here was in the data, we found that physicians tend to interrupt patients a lot. And I think that the statistic was like, just in the first almost 10 seconds of the appointment. And so a big thing here is body language. So sitting up, leaning forward, and then avoiding interruptions as much as we can. And I think here with telehealth in particular, there might be lag time. And so that's a really important time to just kind of pause and let the patient complete their thought and make sure that, that you're not allowing the technology to get in the way of that. And then the third practice is to connect with the patient's story. And so here, a big part of that is really seeing what is the context in which the patient lives and works and has friends, and how does that affect their health? And I think with telehealth in particular, this is an invitation into their home, and it kind of goes back to the olden days when we had house calls and could really see what was their home environment like, who was around them to help them in their healthcare, and how safe are they at home? What's in their fridge, and are they elderly and do they have a lot of steps? And so I think some of those things we can actually see now, and that's great. The last one is to explore emotional cues. And that can be really challenging with telehealth, because I think that oftentimes we use a lot of nonverbal communication to express that we care. And that might mean a hand on the shoulder, or offering if they're not feeling well, we might offer them a tissue or something like that. And I think in this case with telehealth, it becomes really important to choose words really closely, and then just ask how they feel. I think especially during COVID, everyone is tense, and so that's going to kind of overlay the appointment regardless. And so it can be helpful just to check in. Hey, I think there's a lot of stress right now. How are you doing with all of this? Yeah, and I think I forgot the middle one, which is agree on what matters most. And here it's really the same as in person, really thinking about what is the shared goal, and thinking about what we want to talk about during that particular appointment.
Fantastic. And I think it's a wonderfully systemic way for us to maintain that connection with patients. And primary care doctors are often so busy with a lot of bureaucratic requirements, and now with the pressures with COVID. So I think this framework gives us an organized way where we can maintain that connection with patients. If you can give one tip, what's your number one tip that physicians can use to maintain that connection with patients?
Yeah, that would definitely be listen. I think, it comes down to something that feels very simple, but allowing the patient to tell their story, and really hearing what they have to say, I think can go a long, long way.
Wonderful. And let's take a step back. Is there anything that you've been curious or passionate about in the last few months?
Yeah, I think that racial justice has definitely been on my mind, and I've been thinking a lot about how, even just in the words that we use and how we talk to each other, how we can kind of promote that. And so that's been a big topic that I'm thinking about and reading about, and hopefully we can come up with a good strategy to make that work for all.
We're talking to Megha Shankar. She's an internal medicine physician in California. She co-wrote the article, Strategies to Foster Meaningful Connection During Telemedicine Visits. Megha, what's your take-home message for the Kevin MD audience?
Yeah, so I think the big thing again is to listen to not only your patients but to everyone around you. You know, we can learn so much from everyone, and that's how we all learn.
Fantastic. Well, thank you so much for your insight and your time, and thank you so much for being on the show.
Thank you.